You see them everywhere, right? Those little clouds of vapor. And we've all heard it. It's the safer choice. But what is actually going on when that vapor gets deep inside your body? Is it really just harmless water vapor? Or is it something else? Well, today we're going to follow the science and find out what's really happening inside our lungs.
So yeah, this is the big question. Is it a safe alternative or hidden danger? But we're not going to get bogged down in opinions or marketing claims. Nope. We are going to follow the evidence, piece by piece, and understand what doctors and scientists have actually discovered about the real impact of vaping. All right, to really get this, we need to kind of shrink down and follow that vapor on its path. Let's trace the journey from the very first puff all the way down into the deepest, most delicate parts of the lungs. Okay, so it all starts with the inhale, obviously. The vapor travels down your throat, that's the pharynx, and into your main windpipe, the trachea. You can think of it like a big highway for air. That highway then splits off into smaller and smaller roads, the bronchi, which branch out deep, deep into your lungs. And this, right here, this is the final stop, the alveoli. Just look at them. We're talking about millions of these little air sacs. And get this, each one is just a single cell thick. That is literally thinner than a soap bubble. This is the critical spot where your body gets its oxygen. And because they're so incredibly delicate, it's also ground zero for any potential damage from anything you breathe in. So let's jump forward in time a little bit. A few years ago, doctors started seeing something really strange. Young, otherwise totally healthy people were flooding into emergency rooms with this mysterious, really severe lung injury. And they all had one thing in common. They vaped. You know, this wasn't just a few isolated cases. It was a clear pattern. So the medical community gave it a name. E-Valley. It stands for e-cigarette or vaping product use associated lung injury. Now, giving it a name was a huge deal. It meant this was now a recognized medical condition. The hunt for the cause could finally begin for real. At first glance, it looked exactly like a bad case of pneumonia. You know, patients had the cough, the chest pain, the fever. Some were even coughing up blood. Any doctor on the planet would look at that and think, okay, this is an infection. But here's the thing. They were treating it like pneumonia, and the patients just weren't getting any better. And this is where things got really weird. A huge percentage of these patients, we're talking up to 80%, also had serious stomach problems, nausea, vomiting, diarrhea. This was the giant red flag. A lung infection just shouldn't be causing these kinds of gut issues. It didn't add up at all. And here we have the critical turning point in the investigation. Doctors ran every test you can imagine. They were hunting for viruses, for bacteria, for a fungus, anything that could cause an infection. And they found absolutely nothing. The lungs were clearly inflamed and damaged, but there was no bug. This wasn't an infection, it was an injury. Something was causing this. Okay, so if it's not an infection, the answer just had to be in the vape liquid itself, right? The big question was, what exactly was in that chemical cocktail that was doing so much damage? Well, this was the problem. Just look at this list. Beyond the obvious stuff like nicotine and the chemicals that make the big clouds of vapor, you've got literally thousands of different flavorings, oils like THC, and all kinds of thickening agents. It's basically a complex, unregulated chemical soup. Any one of these things could have been the bad guy. To figure out what was actually getting inside patients' lungs, doctors use this really clever technique called a bronchoalveolar lavage. You can basically think of it as a lung wash. They gently send a sterile saltwater solution deep into the most damaged parts of the lung, swirl it around, and then pull that fluid back out. It's like taking a direct sample right from the scene of the crime. And when they put that fluid under the microscope, bingo, they found their smoking gun. In patient after patient, the exact same two substances kept showing up in really high concentrations. THC, which you know is the psychoactive part of cannabis, and something called vitamin E acetate. The culprits had been unmasked.
So, wait a minute. Vitamin E acetate? That's a chemical you find in skin creams. Why is it so dangerous to breathe in? Well, this is the key. Your skin and your stomach are built to handle oils. Your lungs are absolutely not. When this sticky, oily chemical gets inhaled, it just coats those super delicate alveoli, essentially suffocating them and triggering this massive, damaging immune response.
So, all this brings us to the question I know you're asking, the one everyone wants an answer to. Is vaping actually safer than smoking? Let's break it down.
Look,
When you line up all the evidence, the medical consensus is pretty clear. Traditional cigarette smoking is worse. We have decades and decades of data linking it to cancer, COPD, heart disease, you name it. Vaping is much newer, so we just don't know the long-term effects yet. But we do know it can cause these severe, sudden injuries like E-Valley. That's why you'll often hear clinicians call it the lesser of two evils. So, what do doctors actually tell their patients? Well, the guidance is super specific. First, the absolute best option is always to quit both smoking and vaping. Easy. Second, if a long-term smoker just can't quit, switching entirely to vaping is a better option than continuing to smoke. And number 3, using both at the same time, like smoking at work and vaping at home, is a definite no-go. But there's this whole other side to the debate. With all those candy-like flavors that appeal to younger people, there's a huge public health concern that vaping is acting as a gateway to smoking. Is it creating a whole new generation addicted to nicotine? Well, the evidence we have so far does suggest that young people who vape are significantly more likely to eventually try traditional cigarettes. Okay, so let's tie all of this together. Based on the data we have right now, what's the final verdict? According to the CDC, among patients whose E-Valley was so severe they had to be hospitalized, the mortality rate was 2.4%. Now, let's be super clear here. That's not 2.4% of all vapors. That's the rate for the people who get sick enough to end up in the hospital. The vast majority do recover, but the risk of it being fatal is very, very real. So based on everything we've talked about, the CDC's recommendations are really direct and simple. 1. Do not use vaping products that contain THC, especially if they're from sketchy, informal sources. 2. Do not use any product that has vitamin E acetate in it. And 3, and this one is maybe the most important, if you don't already smoke, do not start vaping. Period. So after all that, what's the real takeaway? It's pretty simple. Our lungs have one job, to breathe air. That's it. They aren't designed to be filters for complex chemical cocktails or candy flavorings or oily vapor. The science is still unfolding for sure, but one thing is crystal clear. What you inhale matters. The question isn't just about what's in the vapor, but maybe it's about whether anything other than clean air should be going into our lungs in the first place.